Hey everybody, it's Dr. Jason. Today I want to answer the question that Dr. Bob and I get asked all the time. What exactly do you do in the office? And here's the answer. Well, first, we uncover the hidden root causes of poor health that most doctors miss. And second, we then customize natural lifestyle solutions to restore and optimize health. In other words, we find the problem and then we solve it. It's just that we don't do it with prescription drugs. The way we do it is with lifestyle. You know, how you eat, how you nourish your body, how you move, how you manage stress. But how exactly? How exactly do we find the things that most doctors miss? That sounds like a pretty bold claim. And the answer is the exciting, new, emerging field of medicine known as functional medicine. So what's that? Well, functional medicine is really super science. It's the new science of biology. The real understanding of how our bodies work, how they break down, and how to restore health and optimize it. It uncovers the root causes of poor health by looking at your body as a whole and its interaction with your environment. In other words, your lifestyle. It's really lifestyle medicine. So remember the first thing I said, the first promise. We find the hidden causes that most doctors miss. So let's talk about that. Let's talk about what most doctors miss. The three biggest missing pieces to the personal healthcare puzzle. Missing piece number one is inadequate testing. Let's talk about how we test people in this office. You see, poor health leaves clues. So the question is, how can a doctor fix a problem that they don't see? Because we hear this all the time in our office from new patients. They say, Dr. Jason, I don't look my best. I don't feel my best. I know my body. I know something is just not right, but my doctor says my lab tests are normal. You see, in lifestyle medicine, our approach to health is fundamentally different than most doctors, and so is our approach to ordering and also interpreting lab work. We find things that other doctors miss, and to find those things, you can't use regular lab work. You need what's called advanced metabolic lab work. But unfortunately, most blood work, what you're used to, is incomplete and inadequate. Okay, missing piece number two. This is a big one, nutritional deficiencies. We tell our patients every day in this office, I say, the diagnosis and the treatment of symptoms with drugs, what most people do, that's totally different than what we do, the detection and correction of deficiencies. So in functional medicine, like I keep saying, we're addressing root causes, and a big part of why we get the results we do, especially when traditional medicine fails, is we ask a question that most doctors do not ask. And in fairness, they're not trained to ask or to answer this question. So what is that question? The question is, are you nutritionally deficient? Are you nutritionally deficient? You see, nutritional deficiency is the number one cause of most of the chronic health challenges that we see in this office. But again, ordinary blood work that you're used to does not sufficiently test for this. Again, you need advanced metabolic lab work. Okay? In the scientific literature, it's very clear. Nutritional deficiency leads to over 200 different health conditions. I don't think any doctor worth his or her salt would refute the fact that everything depends on proper nutrition, right? Adequate nutrition to the cells. So then why doesn't nutrition play a bigger part in modern medicine? No drug can ever solve a nutritional deficiency. Only nutrition can do that. I hope that makes sense. So what specific nutrients are you deficient in? You just don't know it. Has your doctor ever asked you this question? Have they ever tested for this? Have they ever prescribed a protocol to solve your nutritional deficiencies? See, in functional medicine, we discover exactly what those deficiencies are in order to get you balanced and in order to get you well. We have to take you, this is key, from nutritional deficiency to nutritional sufficiency, if that makes sense. Okay, now finally, let's talk about missing piece number three. This is my favorite, and I'm talking about toxicity. And of course, our solution, what we call true cellular detoxification. Guys, this is really what sets us apart from everything out there. Detoxification on the level of the cell. So I just talked about taking you from nutritional deficiency to sufficiency. And here we're talking about taking you from toxicity to purity. See, toxins are everywhere. We live in a sea of toxins, 100,000 of them that we're exposed to in the environment every day, virtually none which have been tested for safety. Now, science calls these poisons endocrine disruptors. That's your endocrine system. That's your hormones that are being interfered with. Now, a great example of this that we see every day in this office is what's called stubborn weight loss resistance. You can't lose weight no matter what. Toxicity is a hidden root cause because one of the main ways that your body deals with toxins is by surrounding them in order to protect you. So in functional medicine, you do not have a weight problem. You have a weight symptom, and a major cause is toxicity. But imagine, if you were to remove these poisons, these chemicals from your body would no longer need to hold on to the fat, and you would release the weight. I hope that makes sense. Again, toxins are everywhere. I'm talking about here eliminating things from your body like heavy metals, like infections like mold and parasites, radioactive elements in the water, environmental pollutants, industrial chemicals, things in the food that you eat, the water that you drink, and the air that you breathe. Have you ever been tested for any of these? Has your doctor ever addressed any of them? No, because no drug or scalpel can. Did you know there's over 10,000 food preservatives alone? Over 8,000 different chemicals in skincare. There's over 50 known carcinogens in lipstick. Now the problem is all these chemical toxins, they clog up the main filters of the body, the lung or the skin or the colon. So what happens, or what would happen, if you didn't change the oil filter in your car for 30 years or the bag in your vacuum for 30 years? And the answer is pretty obvious. That machinery would break down, and you would too, and you do. So small toxic exposure every day from many, many sources accumulated over time. So when people ask us, okay, how do we get rid of these toxins? It's simple. It's simple to us. You have to support your body's natural detox system, your body's natural ability to bind and then to eliminate these toxins. And you know, there's so much ancient wisdom for this. There's herbal medicine and botanicals. It's just not a part of pharmaceutical medicine. But it's not only ancient wisdom. There's a lot of new technology that we use, specially selected. These are very precisely formulated natural extracts, and they bind to toxins in your gut and in other tissues of your body so that they can more easily be removed. So in wrapping up, guys, I just want to say there is hope. If you've ever asked, what is my doctor missing? And you've probably asked that because you suspect that something is missing. If you've asked that question, please do not give up. Addressing these major root causes, these missing pieces that we've talked about today, inadequate testing, nutritional deficiencies, chemical, cellular toxicity, the stuff we do in this office every day, that alone will go a long way to getting you back to feeling better, looking better, and functioning at your best. So please, please do not give up hope. I appreciate you listening today. I wish you health and success, and bye-bye for now.